This is Jose Merino, Editor-in-Chief of the Neurology family of journals. The Neurology podcast provides practical information to neurologists and other clinicians to help them provide better care for their patients. Thanks for listening and have a great week.
Hello and welcome. This is Greg Cooper from the Norton Neuroscience Institute in Louisville, Kentucky. I'm speaking today with Behnam Sabayan from the Hennepin Healthcare Research Institute and the Department of Neurology at Hennepin County Medical Center in Minneapolis, and with Natalia Rost from Massachusetts General Hospital and Harvard Medical School in Boston about their paper in Neurology, An Ounce of Prevention, the Growing Need for Preventive Neurology. Behnam and Natalia, welcome to the podcast.
Thank you for having us.
Great to be here.
So to begin with, perhaps you can tell us the central message in your paper.
Yeah, the central message is that we are now living in a new era for neurology practice. While we were very successful in advancing neurological care in terms of the diagnosis and really treatment of so many complex neurological conditions, the landscape is a little different now because we have increasing burden of neurological conditions. And it seems like that we need to do something beyond just diagnosis and treatment, and that would be prevention, meaning that we need to play a more proactive role in early detection, finding root causes and tackling them before a disease would start to manifest.
In the paper, you talk a little bit about why now as well. Why is it important now for us to be thinking about this?
It seems that we live in the era of the brain and neuroscience, right? That everywhere we turn, it's like the last frontier with all the prior experience we had across the house of medicine. Like you take cardiology, diabetes, and other metabolic disorders. We're making so much progress now in obesity, oncology, cancer care, all the other fields have made a terrific progress. And I think brain being the last frontier and neuroscience being the last frontier, we are in the precipice of making fundamental changes in the way we approach neurological diseases. Anywhere you look in neurology, we are not only trying to cure or trying to intervene, we're also trying to prevent and improve the quality of care. We have long-standing evidence, for example, on prevention of traumatic brain injury. We've made significant progress in stroke prevention, right? There's like this whole evolving science about how stroke is not just treatable, but preventable condition. And it goes all the way to the beginning of the nervous system development. For example, we use folate in prevention of neural tube disorders in pregnant women. And that's also all about nervous system. So we have both the history, the momentum, and the future that looks like all of our experience leads us to believe that an ounce of prevention is truly worth a pound of cure. And that's the point of the paper.
This prevention and preventive care, broad terms, what do we mean by that? What do you mean by those terms?
We are already doing a lot of preventive care. For example, if we would take the example of a stroke, when a stroke occurs, we really do our best to provide excellent secondary stroke prevention, meaning that we would prevent the next stroke coming. And we do even tertiary prevention, meaning that we want to really reduce the sequelae of something that already happened, whether it would be a physical disability or cognitive disability. The shift is that the secondary and tertiary prevention, probably they are important. They are absolutely important, but probably we need to move one step back and we need to really think about who are at-risk people. When we identify those at-risk people, we would deviate the trajectory that would lead to a stroke or lead to dementia. I always share with our trainees that the best stroke is the one that never happened. And I think this is really the concept that we are really putting emphasis on.
Would it be fair to say that as neurologists, we have focused on secondary and tertiary prevention, and you're now moving us more into primary prevention? Or did I get that wrong?
No, you're absolutely right. Even we have been involved in primary prevention, but remotely. So we now gather the evidence that you need to take care of your blood pressure, diabetes, prevent traumatic brain injury. You need to improve your sleep. Things have not necessarily been materialized as a day-to-day practice. We've been part of the whole scientific and academic community, but the transition and translation to practice is the key.
I just wanted to jump in and also add to that we can't ignore the fact, however, as we talk about primary and maybe even primordial prevention, right? The stages where disease is not even identifiable or in the very early phases of formation, we cannot ignore the fact that just as we learned this month from the paper that has been spearheaded by the American Academy of Neurology and published in JAMA Neurology, that demonstrated that 1 in 2 Americans are living with neurological disease or disorder. So we cannot leave those people behind, right? And it doesn't mean that if you're living with a neurological disease or disorder, it doesn't mean that we cannot optimize your brain function. And that's where the concept of brain health comes in, because brain health should be accessible to everybody, those who are in the formative stages of their brain development and those who are already living with neurological diseases or disorders, where we can optimize their function through effective intervention, prevention, prognostication, rehabilitation, and all sorts of other optimizing tools that will be available to us in the future. And I will also say that science is developing in a way that we're blurring the lines between the disease and a state of the health that we can control. We're learning so much that there is a big difference between what's chronological and what's biological, what's disease and what is pre-disease state. Our diagnostic tools are getting better. We're also becoming more efficient at identifying disease earlier, and we need to be flexible in the way we approach this concept of brain health and allowing an opportunity for everybody. That's why at the Academy we say brain health for all, right? And we look at all the life stages being involved in the process.
So if I'm hearing you would say we should not look at this too narrowly. We need to be as inclusive as possible and look at prevention and brain health as broadly as possible. Is that correct?
This is where science is taking us. Currently, we're humble, doing research and learning from science, being evidence-based. You develop this sense of being humble in a way how much we don't know yet. With what we know, we can already say confidently that it's not black and white. It's trying to optimize things where we can, trying to prevent things where we can. And that's where the science is taking us.
So you said something else that takes us in a good direction. You talk a little bit about the shift in global disease burden really toward neurological disorders. Can you talk just a bit about that?
I think that we have seen from the evolving data, both on a global level and also on a national level, that neurological diseases or the larger group of non-communicable diseases and neurological diseases, particular diseases of the brain, are starting to take a bigger portion of the pie on that chart, right? We saw 1 in 3 individuals worldwide, and now 1 in 2 individuals in the United States are living with neurological disease or disorder. And this is probably multifactorial, like everything else we're talking about in science and in medicine. But we've heard about this great tsunami phenomenon where people live longer, both testament to some of the societal improvements that happen over the years. For example, access to clean water and more nutritious diets, and advancements in modern medicine. We're victims of our own success here in the way that we have shifted the dynamic between the different groups of diseases, antibiotics, cardiovascular health improvements, development and evolution of cancer care. All of that allows us to live longer and more healthier lives. But then we also know that neurological disorders develop later in life. And that's how brain diseases came into a spotlight in aging adults. And it's also the adults that bear the brunt of environmental exposures, both from the maybe environmental toxins, but also lifestyle alterations that change the trajectory of disease. And that's how we basically have come to this incredible global burden of neurological disorders that we need to deal with, and neurologists are at the forefront of that.
Can you say a little bit about the evidence that we already have for preventive-based practice, for instance, in the fields of stroke or dementia?
We have been seeing more and more first observational, and that was followed by now interventional studies that showing that you can change the trajectory of cognitive decline and you can change the risk of having conditions like a stroke. A stroke has more precedent to that, and now we have guidelines and we have very clear pathways for that. But Now, for example, we know that there are some individual factors that if you can work on, especially if you're in a more middle age or earlier stages of life, you can really help protecting the brain to not get to the point that you would develop a disease. Hypertension is a clear example. A Sprint Mind study was a really clear example that if you significantly control your blood pressure, that would be very helpful for decreasing the burden of small vessel disease and cognitive decline, and ultimately collective MCI and dementia. And the collective knowledge now is that physical activity in any form or sorts is very good and protective for your brain. It is not necessarily about how much you do that, but doing it in any forms or format, especially if you can couple it with social connection. So these are like all very strong observational data, and you can add smoking, sleep, prevention of TBI, and so many other things to that. But also, now we have multi-domain interventional studies that show that if you will be able to identify a high-risk patient because of the social factors or clinical factors, and you would introduce them in, again, different forms or format. It could be online, it could be in person, cognitive training with reducing cardiovascular risk burden, engaging with social activities, or helping them to manage their blood pressure, diabetes, cholesterol, all that would lead to a slower rate of cognitive decline and even improvement of some cognitive domains like processing speed. So nicely, things are coming together. The main diseases that now we have good evidence for are stroke and dementia, but this is really expanding to other conditions like Parkinson's disease.
So you make a very strong case for neurology to shift from that traditional focus of diagnosis and management to more of a proactive approach, looking at lifelong brain health, looking at prevention. But how does the practicing neurologist start to make that shift or transition? What advice can you give us?
This is coming somehow naturally because patients are coming to us more often and asking, okay, I have a family history of dementia and a stroke. What should I do? The other thing is that we are attending conferences and we are learning more and more about these new practices. I can share some experience that we had at our center that I'm trained as a vascular neurologist, and I'm so proud of what I'm doing as a stroke neurologist, taking care of patients with acute medical condition coming to hospital. But then more and more patients, actually caregivers of patients, would come to me saying that my mother has a stroke, my father has dementia, and I've seen that you have some papers in this area. What should I do to prevent going to that trajectory? And that kind of has shaped and encouraged me personally, but also our institution to think about really talking separately to those who are at risk and making sure that we would provide evidence-based recommendations for that. And at the same time, we realize that, and I'm very transparent here, that I cannot do everything on my own, and I need to team up with other colleagues. And the most important colleagues that I identify in my practice are primary care providers. I always try to be available to them, and I always try to be in direct communication when it comes to these cases. And now we have kind of structures and frameworks for risk stratification, as Dr. Rost just mentioned, telling people where you are standing in terms of your risk and then helping them to change that risk through the time. And this is, as we are learning more and more, we're becoming more and more humble about what we know and what we don't know. This is really the trajectory that we are taking to be aware of what we can do even when the disease has not manifested yet.
And I would also add that we are starting to develop some of these resources, not only for specific diseases, but also across the entire domain of brain and neurological diseases and disorders. And for example, this year, we've published a paper with the American Academy of Neurology on the evolving evidence, basically emerging issues in neurology, on the role of neurologists in preventive care. And within that context, we've identified some additional initial evidence that helps us support different domains that could be controlled through preventive care. And that type of information was translated into patient-facing materials. And for those of you who are Brain in Life subscribers, you perhaps seen an article on 12 ways to ask your neurologist with regard to brain health. And that kind of helps open the conversation, just like Dr. Sabayan was describing his patients approaching us with regard to existing family matters. Now patients are approaching neurologists by saying, hey, I've seen this article in Brain in Life, and it talks about 12 different ways to take care of your brain or brain health. How can I specifically get involved, and what can neurologists do to help us? But it is critical that primary care providers at every level, if you're a pediatric neurologist, it's the pediatrician or adolescent medicine expert. If you're an adult neurologist, it could be a PCP or family practitioner, or even geriatricians who get involved with the patient's care, primary care, focused care in the later stages of life. These are all partners in everything we can do in brain health and across the house of medicine. And I cannot say enough about mental health as well, because obviously mental health is an integral part of brain health, and we need to work across the house of medicine with our colleagues in neuropsychology and psychiatry and geriatric psychiatry to help us optimize that brain health that we've been all talking about.
I believe you're referring to an article that Greg Day discussed on one of these podcasts a while back, and so I'd encourage people to look at that. I would also say this paper that we're discussing today should really be required reading for the practicing neurologist. And in particular, the figures were excellent. And without me describing it poorly, would you all mind discussing the pyramid in figure 1 that you had? That gives us a lot of good input.
And the very base of this pyramid is what we do on a daily basis. If a movement disorder neurologist or a neuromuscular neurologist, I want to make sure that I would provide personalized recommendations for my patients. They would come ask, I have neuropathy. What type of physical activity I can do? I have Parkinson's disease. What type of physical activity I can do? And that level, we can also extend it to the family members who are sitting in the room. They might have prediabetes, they might have high blood pressure, and then you would really use the opportunity to extend the education and extend your role as a brain health doctor to the family member. So that would be the second level of this pyramid. And then many of us who work either in academic centers or more and more healthcare system, they really want to have community outreach. And we are one way or the other involved in training future generation of neurologists. And that will be the next level that we can be involved at, to be a resource for our GI colleagues, endocrinologists, to primary care provider, talking about brain health, ways that you can reduce the risk, but also saying to our trainees that we need to think about prevention. We always think about cutting edge treatments in our rounds, in our lectures, but also reminding some basic that prevention is key to reduce the burden. And this really goes all the way to the top of the pyramid. And this is where the wonderful organization like American Academy of Neurology come to action, that would bring things to really a national level, international level, for health policy, for changing the system of care, for changing the way that we design our healthcare system, even our environment and urban cities. So these are the different stages of this pyramid that we're proposing to think about as a brain health doctor and neurologist.
I really love that. So we don't just narrowly see our role in the exam room, but we're educators, we're colleagues, we're advocates. We look across the spectrum. That's wonderful.
And Greg, I also wanted to say that it really provides almost like a framework for a call to action, right? It's almost that kind of thing, globally, act locally, if you invert that pyramid. But at the same time, you could see how you can grow your competency in brain health. On one hand, as Behnam was describing, we are making differences in those exam rooms, neurology clinic rooms, every day in individual people's lives. But we have a potential to take the same expertise and the same passion and the same knowledge and drive for evidence-based practice parameters and take it on a larger scale. So how do you grow your impact, right? So from one individual whose life we've potentially changed by helping them and their family members in the room with them on today's visit, to building that impact at the community level, then through our trainees at the national and maybe international level, and then taking it through the advocacy to the unified approach, and then globally, hopefully, as time goes on.
As we think about bringing this into action, say just a bit about the 4-stage strategic framework that you've laid out.
When we are thinking about change, we need to also think about the roadmap and the stages we want to take to get that road and be successful to achieve our goals. So what we thought about was that maybe we will provide some action items and different stages. They don't have to just be one after each other. They can be simultaneously. But the most important one is the first step, which we will build foundation for that. And we are in the time that the foundation is being developed and is developing very fast, meaning we are generating more and more evidence that modifiable risk factors are related to adverse brain health outcomes. And we would provide some framework for tackling those risk factors. Still, we are really at the infancy of learning more and more about what environmental exposures, what risk factors would lead to elevated risk of many neurological conditions. But this is really the foundation should be really developed. And then we would really bring that evidence to build an environment, an infrastructure that we can apply those evidences to our daily practice, but also, as Dr. Rost mentioned, really expanding the impact through our communities, through our organizations and internationally. And that would really require developing frameworks that would show that preventive care is beneficial, is cost effective, and has financial and structural and organizational sustainability. This is really to capture the moment that this is not just good, but also really has so many beneficial impacts on the economy, on our organization, on the way that we treat people. And ultimately, it's very important to set some parameters that shows what were the impact points, what were the pressure points, and what did we change. So this is a kind of a overall roadmap for how we can go from A to B with some action plans in mind.
And I will just add that there is the whole concept of brain economy that's currently developing. And so this framework feeds very well with the societal impact of neurological diseases and disorders, and how preventive neurology and this embracing the concept of brain health can actually change that destiny that the societies and global communities are bound to face with the growing burden of disease, right? So prevention here, if translated into dollars and cents, that becomes a point of conversation with governments and community leaders and all those policy makers who are trying to assess where the investment gets us greater bang for our buck, so to speak. There is an evolving argument where this brain economy is really something that we need to be very strongly considering.
Made really a very powerful case for prevention. But do you have a specific recommendation or call to action for the practicing neurologist today? What should we all be doing right now?
I will just say, first step is to really embrace the concept of prevention. In addition to excitement that's growing with this approach to brain health and inclusivity and making sure that it's brain health for all, truly, there's also a bit of an anxiety on the part of our neurology workforce where they're saying, can we really do it all ourselves? We're already so busy. The access to neurological care is already limited, and we're dealing with a growing burden of neurological disease. So taking a deep breath, realizing that it's going to take the entire house of medicine, but neurologists need to lead and need to be champions of preventive neurology and health and brain health. That understanding and confidence that we as custodians of the brain, as those specialists who actually have a license to practice brain medicine, we can take charge on setting the course for preventive neurology and prevention and brain health as a concept, and then taking one step at a time. As Behnam was describing, we're making a difference in our clinics every day with one patient at a time.
And with that, would you like to close by saying anything about the AAN's Brain Health Initiative and how this all comes together?
The framework that American Academy of Neurology has provided us to think about life course approach to reduce the risk of neurological condition. And the fact that we don't need to look at one percent, but also we need to look at the populations. These are really adding more dimension in the way that we would play a role as neurologists, but also as, I love the term, Natalia, brain medicine doctors and brain health doctors, really seeing ourselves beyond that boundaries that we always have. The landscape is really changing, and the framework is very important, that we know that we need to act early. We need to think about different stages of the life, and prevention is important at all the stages, pre-conception all the way to those silver years that we want to enhance the quality of life and community engagement and well-being of individuals who may even already have stroke or dementia or cognitive impairment, but still we want to really boost that connectivity and boost that social engagement and well-being of the individuals. Think about life course, think about population rather than just one patient.
And with the American Academy of Neurology stepping into this era of brain health and preventive neurology, with our mission being amended to include promote brain health for all, and our commitment to setting up a national vision for brain health for 2050, we actually written preventive neurology into our vision. We hope that the preventive neurology will evolve to become the evidence-based multidisciplinary specialty to promote concepts of brain health. And so the future is bright with that.
This has been a great discussion. I've been looking forward to it for some time. It has really been a great pleasure talking with you both today. And thank you so much for joining us on the podcast. Again, it's been our privilege to hear from Behnam Sabayan and Natalia Rost about their paper published in Neurology titled An Ounce of Prevention, the Growing Need for Preventive Neurologists.
This is Stacey Clardy, your podcast editor. If you've enjoyed the podcast, please take a few moments to subscribe, rate, and review the Neurology podcast through Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And remember, you can always head to neurology.org/podcast for our full list of past episodes. Or you can also search by keyword in your podcast app for any neurology-specific topics you want to learn about.